evening and welcome. This is Dr. Marcea, and I am your Master Destiny Life Coach and the host of Up Sis Up Women's Empowerment Radio. And here at Up Sis Up, what we do is we help women to rise up, we help women to speak up, and we help women to boss up both in life and in a leadership. And so the theme for this year is saying yes to more in 2024. And I am bringing powerhouse speakers and coaches and leaders onto the network to help women to rise up, help women to speak up, help women to boss up. Again, in life and in leadership. And tonight is no different. And tonight the topic is from trauma to tranquil solutions. Okay, and I have someone very special coming, and I cannot wait to get her on the stage. And her name is Dr. Dawn Cherie, and I know her in several spaces. She's a sorority sister and also a member of Black Door Society, but she's also a licensed mental health counselor. Okay, and she has some other certifications, and she's a has her doctorate in social science, and she's also a certified trauma focused cognitive behavioral therapist, and she has also a certification in advanced alcohol and drug counseling. And so, without further ado, I want to bring to the stage Dr. Dawn. How are you?
Hello, I'm good. How are you, Dr. Marcia?
I am amazing, and I am just so happy to have you here in the space helping the ladies and the men who are also watching. And I want to just give you an opportunity just to kind of just to share with us who you are and what it is that you do.
Yes, so I am a mother of a 4-year-old son. That is the primary thing, believe it or not. That comes first before anything else. He takes all of my time and energy. But my 4-year-old has special needs. I'm also a dog handler. As you can see, my dog is in frame. He is a certified therapy dog with Paws for People. So we do some trauma work in vivo. When we're doing that work, that's when the dog would come into play. He actually thinks we're doing a session right now, which is why he is here. He doesn't know the difference. But I am a licensed therapist, and that's primarily the bread and butter, if you will. I love helping people, so that's what I do.
Well, thank you for sharing that. And you covered so much. You said you started off by saying you were a mom of a
Mhm.
4-year old, and that's
Yes,
the primary thing that takes up all of the time. So I
yes,
know you have you're a mental health counselor, but let's just stay here for a second, okay? So you also said he has special needs, and
he
let's talk
does.
about motherhood and mental health. What
I
comes
think I'm an expert in that.
what comes up for you when you think about those two things together?
Well, there's so many different things. The first thing that comes to mind, honestly, is postpartum depression. A lot of mothers really struggle with that. And I was actually one of those mothers who did. Then it's also, once you get past that point, then it's also just general childcare. Children do not come with a manuscript, nor do they give you the foreplay or the play on what's going to happen in the future. You have to figure it out by doing. And at some point, if you're blessed, mama and grandmama might go home, but you're still there at this child trying to figure it out. So,
Yeah. So you mentioned about postpartum depression,
yeah,
and and again, we're talking about trauma, from trauma to tranquil solutions, and that's a play
that's
on the
right.
name of your business. So
Hmm.
so as we think about trauma, the thing that I heard actually was it today. Someone I was listening to something, and they were saying the difference between depression and anxiety is that depression has to do with past sadness, and anxiety is about future, the sadness about the future. I don't know if how do you feel about that, and kind of how does that play into the origin of postpartum depression?
Right. So I know I don't know necessarily if I agree with that per se, only because in full disclosure, I think we have to take the band-aid off of some of the stigmas of mental health. I do suffer with depression, and it's not because of things that happened in the past per se. It's just that sometimes my biogenetic wiring is just off, and I'll experience moments of what most people would consider sadness. It's sometimes uncontrollable, right? But in terms of that, I do have a therapist because I have to. That's the only way that I'm going to be able to really navigate the two. So that's the thought that I have in regards to the depression itself. In terms of the anxiety, I agree with you. And you're anxious either about something that's happening in the future or even something current, but it's because you're worrying about necessarily how things should go or if they're not going according to what you think they should be. So then you have this anxiety, you have this feeling of doubt and not unsure, uncertainty.
Mm-hmm, mm-hmm, mm-hmm. Thank you for sharing that. And you said a couple of things that
Hmm.
I want to kind of go back to. One, you said stigma,
Yes,
and then the other thing you said is that you have a therapist.
I do.
So I want to now combine the two, and I want you to speak on the stigma of having a therapist.
Well, first of all, in my profession, it is, I think, a taboo for a therapist to have a therapist, but it shouldn't be. And mainly because the perception is that therapists are supposed to have it together. The others will think our lives are very perfect and even on a pedestal, which is not the case. We're still human beings at the end of the day. But most people would think, well, if my therapist have things going on like depression or anxiety or any of these things, then they're not a good therapist. If they can't control themselves, how are they going to work with me? And that's just simply a mistruth. And I know that we're in the reality world and not so much in a comic book, but if you look at the life of Superman, for example, he was able to do all kinds of things. And I use this example all the time. But when kryptonite was around, Superman was useless. His skills, his talents, his abilities, they were useless. So if you apply that to just everyday life, so Dawn is great. She can do it all. She can be a mom, she can be a therapist, she can be all kinds of things, right? A businesswoman. However, when this thing called depression is around and it's out of control, that limits what she can do. It takes away from her millhouse, if you will. So I need to know what it is and how to handle it so that I can be the best that I can be. Doesn't mean that my clinical skills are not good. It just means that I suffer with what a lot of people do, and that's depression.
Mm-hmm. So one of the things that I know about you, Dr. Dawn, is that you
Mhm.
are very forthcoming with you saying, I have a therapist, right? And there are going to be a lot
Yes,
of people who, and providers, people who have therapists, but they're not as forthcoming. But I actually see that as a superpower.
it is.
And on top of that, for those that joined and heard the intro that I gave you, you do trauma therapy and you do substance abuse therapy. And that, in my mind, they're two of the heaviest types of therapy.
It
And it
is.
actually makes me feel feel good that you have a place to unpack some of the things that you are being told and that you're
Hmm.
having to process and that you're having to deal with. And how much more help would that be for us out in the world to have someone to share thoughts.
Well, I'm going to tell you, we have an ethical obligation as therapists. I mean, there's so many. You have an LPC, which that is myself, a licensed professional counselor, and then you have LCSW, which is a licensed clinical social worker. And I'm going to tell you, no matter what discipline you're coming from, you should have someone that you can check in with. Like you said, I'm hearing some really horrific things several times a day on a daily basis. And some of those things are easily out of your mind, but some of them you kind of take them home with you. And you're taught not to take your work home with you, but it's your mind. So what are you going to do? Take your brain out and leave it at the office? It goes home with you.
Yeah.
And you're constantly thinking of ways of how you can be a better clinician and how to stay on cutting edge, right? So you do tend to analyze your stuff, but if you don't have a therapist, someone that can just check it, you can check in with, that can literally give you what you need to make it through the next day, I think if you don't have one, you should run. If you, that's one of the questions, honestly, when you're vetting a therapist. Do you have a therapist? And if they say no, run. They have life too.
Mm,
Things
yeah,
go on for them too.
yeah,
So when that camera goes off and they get in their cars and they're driving home, you don't know what they're driving into.
yeah,
So we can
exactly.
compartmentalize the best of them. But if you don't have someone to help you navigate those feelings, you take the chance of the therapist having a thing called countertransference. And that's when they put their stuff back onto their client.
Mm.
And that is not good.
We don't need any of that. And as you're
No,
saying that, I'm thinking about when I was in the hospital, and patients died. We call it cold blue, and it's some days when you come out that room, that patient is no longer here. But what do? You answer the next phone call. You go to the next patient's room, and there was no debriefing. There was no downtime, and so we get into this habit of, you know what, I'm gonna stuff it. I'm gonna stuff it. I'm gonna stuff it. I'm
right.
gonna stuff it. I'm gonna stuff it. So the take home here is, if if you are struggling, okay, see somebody. If you
1000%.
if you are dealing with a lot and there's a lot of weight on you, get a therapist. Okay. If you And I'm going to switch over because I'm a life coach and a physician, but on the life coach
Hmm.
side, if you're looking to get farther in life, get a coach, right? Get somebody to help you navigate and to help you manage all the spaghetti and things that are in your head, because it can be such a benefit. It helps make that pathway a straight line, as opposed to something that is more circuitous.
1000%. And just for nothing, sometimes all those little curves, you don't know what's around the bend. But helping someone to just take a step back and look at it from a different perspective helps them to help you to figure out what is the next step because you don't know what's around that bend.
Mm-hmm.
And if you go around the sharp edges, from what I've told, if you didn't know to slow down, you take the chance of your car flipping over.
Yeah,
So your mind is the same way. You need to
yeah,
have somebody help you to kind of navigate those big feelings.
yeah, yeah. Because how you react, the decisions you make, that's going to be the thing that's going to determine whether which destination you get to, and
Yes.
the quality of your life, right? Because life is
Yes.
about decisions, and sometimes
Hmm.
we make them all the time, and sometimes lack of deciding is also a decision, right? So what I want to do, first of all, I want to check the chat. We have a lot of our Black Door Society sisters in the room. They're saying hi, Dr. Dawn.
Hello.
They're saying hello, and we also have some other listeners that are in the room. Thank you so much for being here. I wanted to. So this segment is called "From Trauma to Tranquil Solutions," and so I want to talk
I
about.
love that, by the way.
Thank you. So the I want to talk about the trauma, right?
Yeah.
And I think it's trauma focused counseling.
Cognitives, right.
Con-
So the TFCBT, it's trauma focused cognitive behavioral therapy.
Therapy. Okay. Can
Hmm.
you kind of break that down for us? What I hear a lot about trauma focused therapy.
Yes.
What exactly does that mean?
Yes. So if we're looking specifically at TFCBT, which is trauma focused cognitive behavioral therapy, that is dealing with individuals that have experienced postpartum, not postpartum, they can, but it's PTSD. Um, I cannot in my mind right now.
Post traumatic
Um,
stress disorder.
Yes, yes. We're so used to using
I
acronyms
did.
all the time, right?
Yeah.
So this is like after something traumatic has occurred, your body reacts to that, and then it becomes a disorder, if you will.
Mm-hmm.
So the longer that you go without treating this disorder, the more complicated it can be. So usually if it's within a 6 month range time frame, so the trauma happened today, we couldn't say that that's PTSD quite yet, but usually it's after a 6 month time frame. So you want to start getting treatment right away. But let's just say you just didn't even realize that you experienced something traumatic, right? You didn't think that that was something that really had a trauma experience. Well, that turns into PTSD. And how you know is because most people become hypervigilant, meaning like they are like really looking over their shoulders. They have nightmares. They
Mm,
keep ruminating, like thinking on things over and over and over and over again. Even in a crowded room, they feel alone. All these different feelings. They have a lot of irrational thoughts, and that's all based off the trauma. But these things can lead to other things like keep you from sleeping. We all know if you're not getting a proper amount of sleep, you're not going to be
mm,
productive to anyone. And now you're talking about potential mania. So trauma can lead to all kinds of things, even physiologically, that we want to avoid. So the sooner that you can get to someone that can help you unpack it and understand what it is and how
mm,
to move forward in the future, the better off you will be in your
mm,
relationships individually. So trauma, it's pretty significant, and it's
mm.
not a term to be used loosely. So, that part.
So let's make this a little bit more granular. Okay, so you talk
Yeah.
about trauma, and when I
Hmm.
think about trauma, I'm thinking, seeing someone being killed in front of me, me being sexually abused. But I
Yeah.
know that bucket is a lot bigger than that. What can you
1000%.
share with us what that trauma label could represent?
So what you just the examples that you gave are what most people would think of. But trauma can even extend to going to the dentist and having a tooth extracted and having that whole procedure so upsetting to your system that you just can't get past it. It's causing you all kinds of distress. You cannot work, you cannot eat, you cannot sleep. You're constantly ruminating on it. And yet they're two separate things that are horrific, but for someone that could be traumatic. Or even like, for example, Hurricane Katrina, that's another screener that people use if it's like a natural disaster, or anything of that nature, a volcano erupting, taking out a town, anything like that. It's not just the fact that someone dies, it could be anything like that. Seeing domestic violence in the home and watching a parent or a loved one, you know be hit and hurt and have that play back in your mind can still have you feeling the same way that if you were unfortunately sexually assaulted or even seen a murder.
Mm-hmm. Mm-hmm. That is so good. So it sounds like there's trauma as far as defining what that could be, but it's also a function of the individual and what they find triggering and traumatic.
1000%. And actually, when I'm working specifically TFCBT, which is the trauma focused cognitive behavioral therapy, is an evidence based for children. So that's a modality used to treat children. Now, for adults, there's other things such as EMDR, and that's dealing with like your eye movement and tapping, and you have to be a certified clinician to handle that. Now that one is about maybe 8 weeks, where TFCBT is like a 12-week program. But it's really how the person sees the event. Like, I can't tell you what's trauma. I can tell you in terms of definition, but
Mm-hmm.
if your mind is playing it back in such a way where everything else is elevated, you're hypersensitive, all of these things, then guess what? You're having a traumatic response. Now, it may not be what I have experienced in my lifetime, but that's not how we define trauma. It's your personal experience and what matters to you and how your brain processes these events.
Mm-hmm. I love that you said that because I wanted to ask you a lot of times when we experience trauma, okay, whether or not we're calling it trauma in that moment, the our desire is to have someone else to validate our trauma.
Right. Which means the worst thing that a clinician can do is to pacify it. So, for example, um, I work with kids primarily, some adults as well, but we're working with children. They will recall a specific trauma. And usually with TFCBT, not usually, but all times, you have to have a narrative. So the child at some point would get ready to read this traumatic experience to the caregiver. I am working with the caregiver separately than working with the child, but I'm preparing the caregiver not to dismiss what the child is saying. So, for example, the child might remember, well, I came through the green door. I don't need the parent to say, no, actually, no, the door was yellow, because then what that does for the child is it dismisses what they're feeling. They recall
Mm-hmm.
the door being red. So I try to get parents to stay away from those type of details and wanting to comment in such a way and just say what we're working on here is the fact that this child feels this way about this event that happened to them, and as a result they have sustained all these different type of behavioral concerns or emotional concerns, and we want to see that be dissipated to alleviate some of those issues. And the parent, all of us are on the same page. We just want the child to get better. So looking at details like that nature, well, no, it didn't happen like that, really, that was your grandmother, that's not helpful.
Mm-hmm.
What is helpful is, can you hear mom or dad what I am saying and how this particular thing manifested for me?
Mm-hmm. Mm-hmm. So take that one step further.
Mhm.
So the scenario I'm thinking about is if someone was raped, right? Someone was sexually
Yeah.
assaulted. And there's so many things I think that happens about, I don't want to say it, but then if they get to the point where they do say it, and then the offender denies it, or the parent who is related to the offender denies it,
Mhm.
how does that play out as far as for the client, for the patient?
Well, if we find something like that, first of all, like I said, I'm working with the parent separate from the child. And that's for a good reason, because, like what you just stated, I cannot take the chance of having something like that unfold in my office, because that's devastating to the child. Like, that's not helping the child move forward,
Mm-hmm.
right? It's actually just validating the feelings that they have that no
Right.
one really cares.
Right.
Right. So you're working with them separately. So the child in all cases seem like they're ready to go and get to the narrative faster than the adult. Sometimes the adults just have a hard time knowing that these things happen to their child, and then also feeling guilty, like, why didn't I do something to
Mm-hmm.
help prevent that from occurring? So if I find that a parent is struggling with the details that the child is stating, because remember, I'm taking the same narrative and the child doesn't know, but I'm working one-on-one, so the parent heard that narrative
Mm-hmm.
and they're not ready, or they need their own therapist. I cannot allow them to go to that stage, because it's to do no harm. So that means I'm maybe making a referral for that parent to get some therapy, or I might I just won't definitely won't be moving forward until I know that the parent is in a safe space that they can fully help the child. I want to almost, you know, almost like a magic wand. I want to dictate what you're going to say. I need to know what you're going to say and how you're going to react
Mm-hmm.
before
Mm-hmm.
we get there.
Mm-hmm. Mm-hmm. All right. Thank you for clarifying that, and that's such good work that you do. So what I want to do is I know there's a story behind why you do what you do, and I know you help you help people who have experienced trauma,
Mm-hmm.
and as well as substance abuse. But what is it? Can you share with us why you do what you do?
Yeah, so prior to being a clinician, I was a paralegal, worked for a very prominent law firm in the state of Delaware. Will not say who that is, but in the midst of working with them, I had a stillbirth. I lost a child, and it was, excuse me, very devastating. We were trying, my ex-husband and I at that time, we were trying forever to have a baby, and we went through all these things and they just failed, right? And then the last thing was just to be pregnant with a baby, give birth, go through labor, all of that, and then you can't take them home. And while you're pushing and going through all these labor pains, you already know the child is no longer here, right? You have some time to hold the child. You can feel them, see their hair, even clothe them, but you cannot bring them home. You go home empty, and they call it stillbirth because when the child is born, because you're pushing like a regular vaginal birth, but there's no crying. no one says anything. It's silent, which is why it's still. Everyone's still. They call it a stillbirth. But when that happened, I already went through some things, growing up, and I thought I could handle just about anything. But when that happened, it literally destroyed me, and I found that I was suicidal. And I just felt like there was nothing worth to live for. Like this thing, my body failed me. I felt like a woman with a failed body. So what does that mean, right? Everyone in my family has children. Why can't I? And when I realized I was kind of going down that path and it was not a good one to go down, and I knew I needed more than just what the hospital was offering in terms of grief share, I sought out a therapist.
Mm-hmm.
But I didn't share with them that I was actually contemplating taking my own life. And they said, well, we have opening in 6 weeks. And I was thinking, I don't think I'm going to make it one more day rather than 6 weeks. And I think it was maybe the sound of my voice because I was on a telephone call. That therapist at the time, she was like, you know what? You don't sound like you're in a good place. Let me just move some things around. I'm at capacity, but I'm going to bring you in anyway. And she did. And I don't know what I would have done had she not been there to guide me through that very traumatic, very horrific thing. And I remember thinking, no person should ever have to be told that they cannot have therapeutic, access to wellness because of constraints of time and clients and so forth and so on. So I literally left that job. Well, actually, I was forced out of that particular job and ended up suing and winning. But as a result of that, I decided to go back to school and become a clinician. But at the time I was like, I still can't work with kids because I'm, having all this loss. Like I suffered 23 miscarriages and a stillbirth, which is an obscene amount of miscarriages and stillbirths. They told me that I couldn't have kids, right? So the last thing I wanted to do as a therapist was work with children. But when you're first starting, they have you working with children. So, I mean, but I think in my spirituality, I believe in God, that was just where it was. But I became the best child therapist and adult that there is in my mind, because I know what it is and I'm able to speak to that thing and I'm able to provide hope because I know because I've been there, right?
Mm-hmm.
So that's how I got to this place. And I would have been happy with my, paralegal job. I was a good paralegal, but that wasn't where my destiny was. I was
Mm.
helping people, but not as much as I am right now. I
Yeah.
help people that are not even like broken pieces. They are shattered fragments of sand. And I help them put it back together to some shape and form so they can move on and have a productive life after the trauma. That's what I do. And that's what happened to lead me to this space.
Oh my gosh, that is amazing.
Thank you.
Oh my gosh. And you said you had 23 miscarriages.
23. Yeah.
Okay. Okay. 2, 3. Okay. Someone in the chat put
23.
2, 3. Not,
As in Michael Jordan, 2,
yes.
3.
I've had one miscarriage and it took me to a place that was dark and still and
Mm-hmm.
loss and feeling not good enough and not knowing it's that not knowing what's going to happen next. Can I get
Mm-hmm.
pregnant? Will I have children? Will why, right? But you went through that 23 times.
I did. I did. I did. And, my marriage did not survive it. There were so many things that happened, but I was so focused on trying to have a child. And the worst thing was when people would say things like, well, don't you guys want children? And it's like, I do want them. But then, coupled off of that, so you go through all this, they tell you, Dawn, you cannot have kids. You're like, all right, well, I'm just going to live my best life, right? Here comes Christopher at the age of 43. 43 years old. They were calling me geriatric pregnancy. But then, on the heels of his birth, I went into a very bad postpartum depression. So
Mm-hmm.
then people were like, I don't get it. I don't understand you. I thought you wanted kids. You had all those miscarriages. Why are you depressed? Like they don't understand. It's not a choice. It's not like I say, don't want to wake up. Please sign me up for depression today. I think that sounds like a good, I would take a side of depression. That's not how that
Mm-mm.
works. Like the chemistry in your body chemistry in your brain is off. It's just like you think the most craziest thing. And I didn't even realize I had postpartum depression coming off of all those miscarriages. I was in the car driving and I had an infant in the back. He was little at that time. And I was on the phone with a girlfriend, and safe, of course. And I remember there was a truck, and I just out loud said, I wonder what it would be like if the truck just hit me, but don't kill my baby. Just, I don't mind if I would go. And she said, what did you say? And I said it again, just as a matter of fact, as if I was telling her to go outside because it's raining out there. And she said, Dawn, I think you have postpartum depression. And then I realized I stopped talking to people. I wouldn't invite them in. I stayed to myself. Like I wouldn't talk. I didn't eat. I just stayed away from people because I didn't want the judgment of asking me questions like, well, you had all those miscarriages and you finally, didn't you want a baby? That's the stuff you would get. So so I had that and then I had to deal with it because then there's this whole thing about postpartum, right? So you have the whole thing of, having the miscarriages, and then you have this whole postpartum thing. It's like, okay, well then what's going to give? Like all this stuff is going on. So, but again, every test comes with a testimony. I'm able to help
Mm-hmm.
people through that. So now I work with a lot of OBGYN offices and I work with mothers before they actually give birth. So if the doctors are seeing that they're starting to fall into this like slope, they'll call me and I'll start working with women to try to really reduce the possibility of a postpartum diagnosis following birth. So
So is that a thing? You can pinpoint someone who you think is at risk for postpartum depression, and you can actually prevent them from becoming depressed
now, I
postpartum.
didn't read any empirical research that would, really speak to that, but I can tell you that the clients that I have been working with from the OBGYN's office, that seems to be the point. I mean, I would have to do some research and have a good
Understood.
sample size but yes, so far what I have seen and what this doctor have seen, yes. And it's typically, I'm gonna tell you, it's typically mothers that have a lot of stress on them. If they're married, they're having some issues in their marriage. If they're
Mm-hmm.
single, they're trying to figure out all these other things and they're transitioning into their bodies and their hormones doing all this stuff to not having anything at all, and then all the supports just drop off, and you have a baby crying all the time and you're like, now what? Right? So we found that actually doing the therapy and like intense therapy, getting them prepared and helping them look at what their support systems look like and how to like talk through some of these feelings, we found that it did reduce the likelihood that they would have postpartum. And we tried it with women who just gave birth, and then we also tried it with women that were, right before giving birth. Like, so I would say like maybe 2 months before giving birth, like if they're telling their OB, I'm stressed out about this and this is going on and this, they would then say, why don't you try therapy and let's see how that works. And then I would work alongside of a psychiatrist though, because in case there's medicine that's needed, because it's very hard to medicate a pregnant woman with mental health. You have to be very careful.
Yes, very absolutely. So, you said intense therapy.
Hmm.
Can you define what that could look like?
Yeah, so when you have outpatient therapy, and that's like an hour every week or an hour every other week, and then you have intensive outpatient therapy, and that's when you have like maybe 2 or 3 sessions in a week. Now,
Okay.
for clinicians that are listening to this, you have to get permission from the insurance company if they will pay for a service like this, because typically the rule of thumb is if you require more than one session in a week, then you should be looking at intensive services. So, like at your psychiatric hospital's day program, for example, when you go in there and then you come, go home at the end of the day and you come back, and that's usually like a week or so. So it's really case by case basis. But if you have like an employee assistant program, sometimes you can stack them, or if you have a really good doctor that can like really say, no, this is what they need, and I think it's good at this setting, then you can be approved for something like that. But yes, that's what I mean. Like it's intense. Like we're gonna cut the fluff. We just got to get right to it. and we're very localized in terms of treatment.
Mm-hmm. So you mentioned about the women who more so are at risk for postpartum depression, and there's a
Mhm.
stress level that may be in association with that. And I know that you were able to speak to burnout this past
Yeah.
weekend. Can you kind of just share a little bit about what that event was all about and what you shared?
Yeah, so I had the honor of participating in the Diaspora Multicultural Women in Business conference that took place at the Gaylord in Washington, D.C. And it was very important to Coach Ogo. That was her event, that she had a panel to speak to entrepreneurs about how to handle burnout when you're still trying to make a difference in your communities, as well as just, and run your families and do all these things that you're doing, in addition to trying to really get some health care things going in our communities, right? So we spoke, it was myself, it was also Dr. Roz, Dr. Nima, and Sharon Morton with SiriusXM. She was the host for that event. And we just talked about the common everyday burnout that individuals will feel, and whether it be your family, your job, and what to do with it, how to turn that burnout into a success where it could turn around and make you money, basically. So we just talked to women in real spaces, give them a platform to be open and honest about how they're feeling and how to turn that trial into a triumph.
Mm-hmm. Mm-hmm. Yeah. Heard that was amazing. And
Was.
so I just wanted to kind of bring that home for those
Mhm.
that are listening who are stressed out, who are burned out, who need an ear. What would you say to those women and men?
I would say don't ignore it. The first thing that you can do is acknowledge it. Acknowledge that this is a thing and that you're feeling something, and don't ignore that. Pay attention to that thing. It doesn't mean that you can't continue to work. It's just that you need to have some infrastructures in place to help you to lift the burden a little bit. So whether that be a life coach or a therapist, someone that's going to help to really center you so you can compartmentalize what that looks like, because I'm not saying that you should just stop working altogether and not pursue your dreams and just, oh, I'm burned out, I just need to do this. Because we all know that life is life, and that's what the kids say at least, and that we have to do some things to make sure that we can keep going. So get a coach, get a therapist, get someone that can help you figure the ins and outs and help to recreate a better you
Mm-hmm. Mm-hmm.
with some
Absolutely.
boundaries.
Absolutely. So I mentioned that the title for this segment kind of had a play off of your business name. We're calling it From Trauma to Tranquil Solutions. Can you share with us what your business is and how folks can contact you?
Yes. So my business, I'm a private practitioner. I'm a licensed therapist, and I work with people. You don't have to necessarily have trauma, but I work with people who have what we call co-occurring disorders, meaning they have mentally, like maybe depression, anxiety, grief, whatever that is, coupled with substance abuse. There's some kind of addictive behavior. And so I am certified that I can handle both of those things. I have not to date had to advertise my services. I am blessed to say that it's been out of word of mouth, which is the best, right, to have. But I do work with individuals that require those things. And even if you just like, I need an ear to talk, I had someone call me once and say, I am okay, but I just need to learn how to communicate better so I can have healthy conversations with my spouse. And we were able to do that, and they were able to learn some things about themselves. So the way that you can contact me, and you go to www.acenteredmind.com, and it takes you right to my website, and you can fill out a contact list there. Or you can also go to www.drdawn, DAWN, Cherie, SHEREE.com. And there is also a contact form there that you can fill out. And I will take all of those things in. Please provide your email address as well as a working telephone number, so that I can call you. And then I like to have clients in the following week. I don't like them to wait 6 weeks like I was told initially. I want you to come in within 7 days of your phone call.
Yeah. And that is just so powerful. As I listen to your story, the two things, or multiple things, but things that I'm going to share right now is that one, what you just said is that you, because of your experience, you are not going to have them wait. Okay.
Right.
Who knows what would have happened if you had had to have waited longer than you did,
Yeah.
right? And then the other thing about your story is that because you shared about your son, right? And the
Yeah.
miscarriages, but for those that were on and heard the very beginning of the show, when I asked you to introduce yourself, you said, I'm a mom of a 4-year-old.
I am.
Okay. And so, and I just got chills just for a second, right? There, that is, that is the primary thing for you. And even though there's struggles, the blessing of him being here and what you had to go through, it sounds like it's all worthwhile, correct?
It is. Now, I'm not gonna, because I know, and that's the other thing I think we need to talk about, not tonight maybe, but it is okay, moms. I'm gonna look right at the camera. Moms, I'm talking to you. There's a mother, I'm sure, that is watching this right now. That's like, she talked about it, but it was all the nice and fluffy stuff. There's some real stuff going on, and I can help you with that as well. Like, there's some mothers that are thinking about hurting their babies. I can help you with that. You get so stressed out, and we don't talk about that because that's the dark side. Nobody wants to talk about that, right? But those are the type of things that I help you with. I create a safe space. I can't even, a safe space. This is a space where you can come in, you're with me, and we go there. We talk. But it's not just the things you say out of your mouth. I respond to nonverbals. It's the things that you don't say sometimes that scream the loudest. And all I want to do is to help you make it make sense so that you can be able to move forward.
Mm-hmm. Mm-hmm. Make it make sense.
Yep.
Um, so I just completed a transformational coaching certification, and one of the
Hmm.
things that um, was said is that they were it was for children, but
Hmm.
it can be extrapolated to adults,
Okay.
right? What we do is that we need it to make sense. Whatever is happening, if mom and dad are fighting, if someone's no longer here, if they're getting bullied at school, whatever it is, okay, children slash adults, we need it to make sense, and we will do anything to fill that void. So
Right.
we will put something there, okay, to give us an answer as to why things are the way that they are. And so I want you to just kind of to speak to that in what it is that you do.
Okay. So I just want to just make sure I got the question right. So you just trying, you wanted me to speak to the make it make sense. Is that
Yes,
right?
make it make sense. Yes.
It is okay not to be okay. It is okay not to be okay. It is okay not to have all the answers. It is okay not to be perfect. It is okay that your life is going a certain way and you had these plans and they're not working and you're feeling disappointed. That is okay. The first thing I need you to do is acknowledge that piece. Because if you can just do that piece, which to you might be the smallest thing, but that's the biggest step to the first step to getting the help that you need. Because once
Mm-hmm.
you acknowledge that, once you wrap your mind around that, now I can work with something. Now we can
Mm-hmm.
say, okay, what kind of sand are we working with here? What do we need to do to put this thing to make something out of this?
Mm-hmm.
What is the life that you desire to have? How has your life been now? What has your background been? So that's what I mean when I say make it make sense.
Make it make sense.
Acknowledge where you are and be honest with yourself
Mm-hmm. Mm-hmm.
and be prepared to do the work. Because a lot of times people will try to seek therapy and they're not ready. They get hit with some stuff and then they shut down. I need you to be ready, make it make sense. I'm going to meet you where you are. I'm not expecting you to be 10 people down the road. I'm expecting you to show up exactly the way you
You
are.
are, yeah, that's good. That is good. That is good. So I know what you do during the day, but I also know that there is an event coming up
That's right.
that I want you to talk to share with us. Tell us,
Yes.
tell us, tell
So
us.
I'm excited. It's my first ever event. And I live in the state of Delaware. So, if you're in the DMV, and let's just say, and not in the DMV, and you're in Philadelphia in Jersey, I want you to come on over to Delaware on April the 13th. It's the Built to Last Women's Empowerment Conference. And I created this because like I said, I'm a single mom of a 4-year-old. That's a hard job. I'm an entrepreneur. I have goals and ambitions. And sometimes we get bogged down. And here we are in this winter, right? So I was like, what better way is to give these women some peas inside of this candy? I'm going to give you the candy. You're going to eat the candy and then you're going to get a whole nutritional meal out of this thing, right? So what we're looking at is 5 domains. So we're looking at your mental health, your physical health, your spiritual health, your finances, and keeping this space right while you're going through all that. Because let me tell you something, I'm going to teach you how to lead while you bleed. Sometimes we're in situations where we have to accept things. And while we're acknowledging it, we still have to keep this together. We still have to keep our prayer lives together or whatever it is that you do, right? We still have to keep our bodies right, eating the right things. We have to keep our money right so we're not running into situations and we're struggling. If any of those things touched you in any way, you need to be at this conference. I have some things going on that I'm going to keep a secret, but you need to be there. You will get to connect with other women. And let me tell you, I believe strongly there is power in numbers. So you get enough of us women together, right? And it's only a limited seating. So you get enough of us together and we start networking and creating a safe space so we can have a healthy dialogue about the things that are plaguing our communities and that's going on within our own homes. Guess what? Now you're setting yourself up for all kinds of success because there's
Mm-hmm.
another woman that's going through that you may have thought like, really, you went through this too. So that is what built to last is, because you are built to last. We all are built to last, but you got to make a decision.
Yeah,
You got to make a decision that you want it for you.
yeah. Built to last, built to last. Tell me how that name came about.
Yes, because sometimes, if I'm going to be honest, right? Sometimes I am like worn down and I'm like myself, like feeling depleted. And I'm like, Dawn, but you can do this. You were built for this. So just because you have a pit stop and this road is a little bit bumpy, it doesn't mean it is always going to be that way. So I want to literally encourage women that they are built to last. I'm going to teach you how to dig down deep and grab that je ne sais quoi and make it work so you can last. One thing about a mother, she can take a little and make a lot with it.
Mm-hmm.
She
Mm-hmm.
can make that thing last. It's just it's a part of our DNA. And if you don't know you can do it, we're definitely going to give you the tools that you need to get it done. We have amazing speakers coming. One of them, which happens to be our Black Door Society sister, Christina Sakar, she's coming from JP Morgan Chase. And you have also Dr. Ronnie Burnett. She is a licensed physician here in the state of Delaware, great with internal medicine. So a lot of people love her. You have Pastor Leah. She is amazing, but she's going to keep it 1000% real. So if you want to hear a first lady talking about some real spaces, then you definitely come on down. We have Ethel Bonfon. She is our mistress of ceremony, and she's amazing, amazing. I actually went to my master's program with her. And of course, you have my McFashion is what I call her, Alicia McFashion. She does all kinds of makeup. She's gotten so many awards for her work, and they're all going to come together and we're going to work together to figure out, like, we hear you and we're here to serve.
Awesome.
So
So,
built to last. If you make it through this winter, that means you need to be there.
yes. So, can you share how they get tickets?
Yes, 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 yes. So I actually, well, there's a link, but the link is to a device called Square, so that's not going to really help. But if you go to www.acenteredmind, again, the same as my private practice, acenteredmind.com, that will take you to the link so that you can purchase tickets.
Awesome. I plan to be in the house and I'm
Yes,
going
and you
to,
have a VIP ticket,
I
so you have some
do.
things in store.
All right. I like the VIP. All right. But I cannot wait to get into the room and to learn those five pillars and to take some nuggets away. So as Dr. Dawn, as we get ready to close,
Yes.
I want you to share for those individuals who are looking for a therapist.
Yeah.
What are some tips slash guidelines that you would recommend they use as they are starting to vet different therapists?
Do not be ashamed to ask for a certain kind of therapist. Some people will say, I only want a black therapist or I want a female, and then they'll feel bad, like, oh, I'm so, feel bad that I asked for that. No, this is Burger King. You get to have it your way. There's so many of us, and we want to make sure that it's a good fit, right? So that's number one. Do you feel comfortable with this person? Ask them, do you have a therapist? Because you want to know, really, honestly, without going into their personal lives, how they handle their own stressors. How are they processing their own lives before they can touch mine, right? That's the other thing. The other thing is, the third thing is you have to ask yourself, is this a person that I can work with? Is this person going to push me? Do they have the certifications and evidence-based approaches that will get me to the desired end? So those are the things you want to look for and move accordingly. Be ready to work. They should meet you where you are. They shouldn't work any harder than you because it's got to come from you. We got to get you to work. So those are the three suggestions that I would say that a person should have if they're looking for a therapist.
Mm-hmm.
Are you comfortable? Do they have a therapist? And what are their approaches? How are they? What are they certified in to help you?
Mm-hmm.
Who says that they're qualified to help you?
Mm-hmm. 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 Good information. So I want to see if we can tap into Duke Ellington tonight.
Yes, and now he's gone. He
Oh,
was
he's
like bothering
gone.
me
He's
all night. He's
gone. Oh
gone.
no. Okay,
I can
so
call him. He'll come. I'll
I
call
want
him.
to.
He'll come
So
over.
he wasn't in the frame when earlier. So I kind of want you to kind of just demonstrate kind of just how you use
Oh yeah,
him in.
Duke up. He's right here. Up,
Okay.
up. Okay. He's like, Are you sure, Mom? So this is Duke. He is a ginormous golden doodle. That means that he is half golden retriever and half standard poodle. And he's very big. So I'm 5'2". Duke comes about to my waist. He's a
Wow.
very, very big dog. He was trained by a retired Delaware State police officer, and he does the trauma work. Now, the thing that kind of freaks people out about Duke is that we work at William Penn High School in Delaware. But what freaks, and also in my practice, what freaks people out is that he can discern if you're not 1000% where you're supposed to be. So, for example, if I said, Dr. Marcia, do you like the ice cream? I want you to tell me yes. Dr. Marcia, do you like the ice cream?
Yes.
But yet I see this. Dr. Marcia, do you like the ice cream? Yes. Yeah. Oh my gosh. I love this ice cream. Duke will do what he has to do. He works for treats. So he's going to go over to you. He's going to get up. I'm going to ignore him. He's going to walk over to you if we're in person, and he's going to come under you. And he's going to keep doing it until you talk. It takes a lot of energy for us to do that. Yes, that takes a lot of energy, right? I can do the same thing, but the dog, remember, he works for treats, and there's nothing that you're going to do that's going to stop him from getting his treats. He works for his treats. If we were not in person, because a lot of people think that he won't do that, but even when we're working in person on telehealth, and Delaware is very big for their telehealth, he will actually come into the frame and he'll keep nudging me. You'll just keep seeing the dog come under me and my arms will go up. And it's very distracting if you're looking at it. And then so I'm like, okay, let's stop. But I forewarn clients, those who don't have an issue with dogs, right? And I'll say to them, listen, the dog is alerting me. we're talking specifically about this. What about this that you're not comfortable with that the dog is still doing his thing? And they'll just look at me crazy. And then they'll start talking like, oh my God, that's really weird that your dog will do that. And once they stop talking, he will go away. He'll go out of frame. And then I can sit there and have a conversation. But as long as they keep this thing going, yes, yes, he's going to be this coming under me, coming under me, coming under me, coming
Wow.
under me.
That's pretty
And sometimes
amazing.
that's anxiety. So, for example, when I first started talking to you,
Mhm.
I'm a perfectionist. I want to get everything right. So he was doing that, not because of you, but it was me. Like, I just wanted to be perfect. And he's like, listen. So I'm like, okay, get out of here, get out of here. I'm trying to push him out of frame. But that's what he does. He also does pause for reading. But the biggest thing is he does like that just grounding work, that gestalt kind of work that keeps you in the present to the here and now. So if something happened 10 years ago, you're petting the dog today. It's just another way of grounding. You feel the dog right now in real time. So
Mm.
that's what he does. And I've had him since he was a puppy. He's 8 years old now. I got him when he was 3 months old.
Wow.
Um, yeah, and insurance does reimburse, not as much as they reimburse for my services, but yes, they do love when I use the dog because he cuts right to the chase. There's no fluff. He's like, yeah, problem. Let's go. Let's get it.
Right. Oh my gosh. Okay. Well, thank you, Duke Ellington, for being a part of this conversation and for sharing. So I'm not a dog person, but this is amazing, amazing work that you do. So, Dr. Dawn, thank you for being here. I know we had some challenges tonight, and we talked about persevering both as an entrepreneur, but even as a mom and as a woman, just in general. So I want to thank you for pressing forward and bringing this to completion.
Oh, of course. It's called, I think we talked about this prior to coming on. It's like you're pivoting while you're parenting. That's
Mm-hmm.
exactly it. Like you just learn how to, all right, that doesn't move like basketball. You just keep moving. Just
Yeah.
don't do a double walk, but you just keep
Right.
moving.
Right. So thank you, Dr. Dawn.
You're so
I'm gonna
welcome.
put you back. I'm gonna put you in the green room. Don't go anywhere yet. But give me a minute, okay?
Yes, ma'am.
Okay. All right, and there you have it. That was Dr. Dawn Cherie Paramore, licensed mental health counselor and a mom and a dog mom and all of the things. And so please reach out to her. Check her out. If you need a therapist, reach out to her. And if you are available April, I think she said 13th, I think it is 13th, come with us to Delaware. Get in the room for the Built to Last conference. And so, with that, I am Dr. Marcea, and I am your Master Destiny Life Coach, also physician, author, and international speaker. Follow me at www.drmarcea.com. And so, until next week, see you. Take care.